My name is Saloni Chaurasia, and I'm a rising sophomore at Rockbridge High School in Columbia, Missouri. Some activities that I participate in include HOSA, Speech and Debate, Science Olympiad, and our local hospital outreach program. My career plan at the moment is to become a pediatric oncologist. However, today I'll be talking to you guys about diabetes. My presentation is entitled Diabetes, the Pandemic of the Future. So before we start, I just want to give a basic introduction to what diabetes is. Diabetes is a series of conditions marked by hyperglycemia in which there is too much glucose or sugar in your blood. There are three types of diabetes: type 1, type 2, and gestational diabetes. Let me show you guys a few diagrams to explain these diseases further. So here's a diagram depicting type 1 diabetes. Type 1 diabetes is an irreversible condition found in juveniles and children. So what happens? Let me walk you through a series of steps that happen in a type 1 diabetic's body. When a type 1 diabetic eats, the stomach converts the food to glucose. Glucose is essential to the body as it provides energy for cells and tissues. It enters these tissues with the help of insulin. However, in a type 1 diabetic's body, the pancreas makes little or no insulin, which causes the glucose to build up in the bloodstream, as you can see over here in the picture. This buildup of glucose can be harmful to the body in the long term, as it can lead to serious problems such as kidney, eye, and cardiovascular diseases. On the contrary, type 2 diabetes is a reversible condition developed in middle-aged adults due to obesity and unhealthy lifestyle choices. These choices lead to insulin resistance as the body has too much glucose to process, and this overwhelms the insulin. Once again, the glucose will build up in the bloodstream, and this can cause hyperglycemia, leading to long-term diseases. And lastly, here's a diagram depicting gestational diabetes. Gestational diabetes is unique as it is only found in pregnant women. It is caused when the placenta interferes with signal insulin induces. So the placenta is an organ that develops during pregnancy to nourish the fetus. It also releases hormones such as those that are listed here, and these hormones interfere with insulin production. This can once again cause glucose to build up in the bloodstream and can be detrimental to both mother and baby. However, in gestational diabetes, the diabetes usually ends after the pregnancy. So now that we've had an introduction to diabetes, I want to introduce the problem that diabetes poses to the world. So here are some statistics related to diabetes that affect the world currently. There are 463 million adults living with diabetes in the world, which is 1 in every 11 people. A lot of these people are undiagnosed, especially those from poorer countries. Currently, in the United States, 1 in 10 Americans are diabetic or pre-diabetic. And each year, over $760 billion is spent on diabetes annually. Now I want to point out some future statistics. By 2045, the IDF predicts that over 700 million adults are projected to have diabetes. This is 1.5 times the amount from today's current number. Furthermore, 2 in 5 Americans are expected to develop diabetes in their lifetime. That's 4 times the amount today. And lastly, 50% of people living with diabetes are undiagnosed, so they don't even account for the numbers that I've spoken today. So now that I've provided these statistics for you guys, I want to bring back the idea of a pandemic. So when we think of pandemics, we think of the world, a disease that affects each and every one of us globally. So therefore, here I have a map projecting how diabetes is going to affect the world in the next 10 to 15 years. The first and most astounding number that I would want to point out is the worldwide increase of diabetes. Numbers expected to spike by 51%, which is drastic, considering we see that we already have 463 million diabetics. In some regions of the world, such as in Africa down here, the number is expected to spike by 143%. Even in Southeast Asia, the number of diabetics is expected to climb by 74%. What we're seeing is that diabetes is hitting us fast, and it is hitting us globally. Now, when we talk about pandemics, our first thought is usually COVID-19, which is why I have 2 graphs showing the eerie similarities that COVID-19 and diabetes share. Now, there is certainly no correlation between the two, but it's important to see the similarities that the two share. As you can see, both of these diseases are spiking and spiking fast. The only difference being that diabetes is getting by as a silent killer. By the books, diabetes fits every notion of a pandemic. It's affecting every part of the world in an increasingly fast manner, and it's going by undetected, which can pose to be even deadlier in the future. But there is some good news. The good news is that diabetes is controllable. There are a few steps to diabetic treatment that can help manage diabetes. The first is diet. Diabetics are recommended by doctors to eat healthier, such as incorporating more fruits and vegetables to their diet and avoiding processed food, such as sugar and carbs. Next is exercise. By exercising a few times a week, diabetics can reduce their chances of death by 50%. Regular exercise can also help prevent diabetes. And lastly is lifestyle changes. By quitting smoking, reducing stress, and regularly using insulin therapy, diabetics have the potential to reverse the disease. Now I want to talk about a small step that I've taken towards this huge problem. For many people who come from lower socioeconomic backgrounds, eating healthy is impossible. And statistically, the homeless population is 3 times as likely to acquiring diabetes than families from higher income. This is where Rockbridge Grows to Give comes in. Rockbridge Grows to Give is a club that a friend and I started at our local high school. Our mission at Rockbridge Grows to Give is to improve the community to the best of its ability while promoting sustainable farming and helping those in need. So what do we do exactly? At Rockbridge Grows to Give, we plant fresh produce at our school's greenhouse and donate it to our local food bank. For many people living in poverty, healthy food is a luxury. By providing them with fruits and vegetables, it's a small steps towards helping those who might not have the resources to combat their diabetes. Here are a few pictures of us planting in our crops this year. Because of COVID-19, we had to abandon our harvest of peppers and spinach, but we hope to get it back on track this year. Which brings me to my conclusion. Before I go, I want to reflect on 3 essential points that can help us towards our fight with diabetes. Firstly is global public awareness. We need to make the public aware of the threat diabetes poses for our future and how they can combat it as well. This can be done through social networking and educational workshops to teach the public about the threat that diabetes has for the future. Next is global solidarity. We need to come together to realize the problem diabetes poses for our future generations. We need to advocate for policy change and come together to make decisions that can impact us for the better. And lastly is individual liability. I want you guys to reflect on what you can do towards helping towards this pandemic. I'm sure that each and every one of us can take small steps to help towards this huge problem. All in all, I would like to thank you guys for listening to me today. I hope you guys learned something from this presentation. If you have any questions or if you're interested in starting a Rockbridge Grows to Give at your own school, you can contact me at the email address below. I've also inserted my club's Instagram handle if you guys would like to follow us there. I would like to thank my parents for helping me work through this presentation and putting up with my many eccentrics throughout this, as well as the Global Health Leaders Conference for giving me this opportunity. Thank you.